Hello. Reporting live from the testing room right now. Hi, Kevin.
Hi, Nancy.
I just realized we're both at on site, but at both of our locations.
Yeah, you're at 1525 Northwest, and I'm here in lovely Southeast, Max Robinson Center. So let's get started.
Okay, so we can start with introductions. So I'll go first.
Hmm?
My name is Nancy. Pronouns are she, her. I've been at Whitman-Walker for about 2.5 years, and currently my position is PrEP Navigation Care Coordinator.
Hi, everyone. My name is Kevin. I apologize if there's like background noise, but I'm currently serving in the capacity of community health supervisor, and I've been at Whitman-Walker for like 2.5 years as well. And my pronouns are he, him, and his.
Awesome. So, just like as a quick introduction for those that are joining us, our community health department has been continuing to expand its efforts and outreach through social media platforms. We've been covering various topics such as HIV, STI, sexual health practices, access to care, social determinants of health, and just general public health interventions. So the next series of outreach sessions will focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. So our community health team is here to educate and support you. And to bring today's topic up, we are talking about PrEP today. So if you have any questions, feel free to write them in the chat. So to get started, just as an overview of what PrEP is, PrEP is an acronym standing for pre-exposure prophylaxis. And basically the idea of it is to take a medication to prevent something. In this case, it's HIV. So HIV, in case you don't know what that stands for, human immunodeficiency virus. This is a daily pill that you are taking. Percent effective. And in order to get on PrEP, you do need a prescription from a medical provider, as it's not available over the counter. And you also must be HIV negative and complete necessary lab work in order to start treatment.
Thank you, Nancy, for that information. It's really good to know because, sometimes we get questions or folks think that it's like over the counter or something you can just get. But it's important to highlight that you do need to see a medical provider, get blood work done, and get a prescription. Um, Now, Nancy, how long does one need to be taking PrEP for it to be effective? And, is there a difference for men versus women when it comes to when you're starting PrEP?
Yeah, great question. So, with the efficacy of the medication and its concentration within the person's body, that's going to depend on their on the type of sex that they're engaging in, and also their respective body tissue. So, for example, for vaginal sex, it can take around or up to 21 days. So, if you are engaging in vaginal or front hole sex, you need to make sure that you're taking PrEP for at least 3 weeks consecutively. For anal sex, it's around a week or 7 days. And if you do have additional questions, you're always welcome to reach out to your medical provider, especially if you're already taking PrEP and you had any adherence related questions.
Now, speaking about adherence, so what happens if I miss a dose or if I'm off the medication for some time? Can I just take it right away?
Yeah, that's a good question. I know I'm forgetful, so I'm sure I would definitely forget to take it for a few days. But ideally, you don't want to miss it for more than 2 days. So, as always, when you're starting prep, you can try to stick to a time where you're consistently taking it to help remind yourself to take it every day. So, if it's like let's say you miss it tomorrow and you realized at 6 p.m. when you normally take it at 8 a.m. You should still try to take it because, we're still in the same day, but then also try to make sure that you are keeping yourself on a schedule so it's easy for you to remember to take it every day.
Yeah, I guess like building that habit, right? Like taking it consistently or taking it with food if it makes it easier or something that's going to remind you, like, hey, I got to take my pill for today. Awesome. Now, Nancy, what about side effects? What can you tell us about that?
Yeah, so most people don't experience side effects, and for those that do, it's mostly gastrointestinal issues that go away in the first few days as your body is getting used to PrEP. There are other side effects that are more long term, like, for example, liver or kidney function could be affected, but because you're on PrEP and being monitored by a provider, those things can be caught early and they're also reversible. If you experience any of these symptoms or side effects, you can just stop taking PrEP and then things will revert back to normal.
Right. And, just to highlight that it's important to be in touch with your provider as well. Of course, like Nancy mentioned previously, there's blood work that's done. So, if there's anything, it can be um, on the radar for the medical provider to check. So, blood work every 3 months, which is really important. Um, Now, Nancy, can you tell us about how we can go about getting on PrEP? And I guess, like, specifically, what if you don't have insurance?
That is a great question. We don't want cost to be a barrier as to why someone can't access PrEP. There are financial assistance like options that are available for patients through patient assistance programs to help cover the cost of the medication. And in addition to that, there are community clinics that offer low cost services for
Mhm.
medical appointments and lab work, which include us. So if you're currently uninsured or maybe underinsured and you're thinking of getting on PrEP, you can give us a call at 202 797 4406. You can also reach our PrEP clinic line through the phone number 202 939 7690. But if you have like questions specifically about insurance and cost, you can get in touch with us as like the PrEP navigation team to work with you to get you on PrEP and also better assist you.
That's really good. And also, if we can get the email address on the comments for Prep Clinic at Whitman-Walker.org and Prep Navigator at Whitman dash or hyphen sorry Walker.org. So if you have any questions, feel free to reach out or need any assistance. Um, awesome. Now, Nancy, could you give us a quick snapshot of what coverage for PrEP looks like? Um, I know that there's been a lot of changes recently, and there's so many insurance plans out there. What does coverage for PrEP look like?
Sure. So, in case you're just now tuning in, we're discussing PrEP. So, moving on to insurance coverage, that in itself we could probably talk about all day.
Hmm.
But as of right now, most insurance plans do cover PrEP. If for some reason you have like a deductible or a copay, there is also a copay coupon card that's available through Gilead that will help bring down that cost to $0. So you don't have to worry about costs with that. And as you are, I'm sure you're all aware, there are so many different types of insurance plans, ranging from government-based to private plans. So if you have any questions or like need assistance with any like specifics, don't hesitate to reach out to us and we can navigate this together.
Now, Nancy, talking about the medication itself, so there's been a lot of talk recently and news stories about it, even about new version of PrEP. And, um, I just heard from a friend that they were able to get like a different bottle with a green cap and it had like a long name that I'm not even going to try and pronounce it. I know that's like the name of the medication itself, but as far as I understand, they said that that was PrEP, but it just looks super, super different. Do you have any comments about that?
Yeah, so that is the generic version of Truvada.
Mm-hmm. Generic Truvada?
Yeah, correct. So I'm with you on the long name. I'm not going to bother pronouncing that either. And I don't think a lot of people are familiar with it. But if you are like interested, you can like Google the generic name and you'll be able to see it. But there is a new pharmacy called Tiva that is making Truvada as well. So it went generic last year, meaning that this pharmaceutical company can also make a generic version of Truvada. So some folks are being prescribed that instead of the name brand, mostly because that's what the insurance plan prefers. And it is a bottle. It does have a green cap on it, and you'll see that long pharmaceutical name. But it is, in terms of its compound, it's exactly the same as name brand Truvada.
So it's still PrEP, right? Still the same thing.
Yes, correct. So it's still PrEP, simply just being made by a different pharmaceutical company. And likewise, there's also Descovy, which is another drug slash medication that has been approved for PrEP use as well. For folks that are taking this particular medication, for the most part, they will require approval by their insurances, but in some situations, depending on the plan, it will be covered right away. So, as always, if you do have questions about that, feel free to get in touch with us.
Awesome. And then another thing I wanted to add as well was that Descovy is currently not approved for women or for frontal or vaginal sex just yet, but hopefully it will be in the future. So Nancy, thank you for all this information and for all these updates about PrEP. But I guess like just to start from the beginning, how do I know if PrEP is right for me?
Sure. So that is like a really good question. And so one thing that we want to highlight about PrEP is that it's not a lifetime commitment. You can start or stop whenever you want, and it's ultimately a personal decision on when and if you want to start or stop. So just some things that can kind of help um, get the ball rolling personally if you are considering PrEP. If you don't always use condoms, external or internal, when you're engaging in anal or vaginal sex, maybe you don't always ask a partner to wear a condom. If you've been diagnosed with an STI in the last 6 months, if you're unsure of the HIV status of your sexual partners, or maybe you're in a relationship with a partner who is HIV positive and who may or may not be on treatment. Or you could be a person who injects drugs, or you're in a relationship with a person who also injects drugs. Um, Kevin, I don't know if there's anything else that you would consider if you were interested in PrEP.
Yeah, I guess like the most obvious one it seems it would be like if you're of course HIV negative and you're interested on getting on PrEP. If you are dating and seeing multiple folks, or if you have multiple sexual partners, I know a lot of people also worry about getting HIV and that like affects folks from enjoying sex. And we at Whitman-Walker, we believe that sex should be something that's enjoyable and, something that's fun and, that's um, not something that's going to be at the back of your mind, like, oh gosh, like what if I catch something? Or if you change sex partners frequently, or if your partners are known are suspected to have other partners. So if you're not sure if you're in a mutual monogamous relationship, likewise, if you're living in an area with a high prevalence for HIV, um, For example, I know here in DC we're like considered like a high prevalence area, or if you travel to places with high prevalence for HIV, um, like ironically here in DC, or I guess unironically here in DC, since we do have a high prevalence for HIV compared to other places in the US and even other places in the world. And of course, it only prevents against HIV, not STIs. Um, but yeah, those are some things to consider for getting on PrEP. Now, Nancy, can you just give us a quick snapshot of what PrEP at Whitman-Walker Health looks like? Um, if I were to become a patient to get on PrEP, what does that look like?
Yeah, I can walk you through that. So, you can schedule an appointment with us by calling our PrEP clinic line or shooting us an email. You can also complete our registration forms through our website if you wanted to get ahead of the game. So you can find those at whitman-walker.org. You'll see a big blue icon that says Become a Patient with Us, and that's where you'll be able to fill out all of our forms. Once you complete the forms, you'll be scheduled to see a medical provider who will go over PrEP with you at the time of your visit and also complete any necessary lab work. Once that's completed, you will be getting a 3-month prescription that you can take to any pharmacy of your choice. And after that, you'll just follow up with a provider every 3 months to continue to receive a refill. In addition to that, we do also offer a PrEP clinic, which is unique to our center, and that allows you to do your follow-up appointments with a trained staff trained staff member known as a PrEP specialist. So you can complete all of your blood work and also do your pharmacy visit in one. And for some people who are eligible, they can receive their medication right then and there as well. So if you wanted more information about that, or if you were interested in getting started, you can give us a call at 202-939-7690.
Awesome. That sounds amazing. Just making it easier and more accessible to get on PrEP. So, website, phone number, emailing us through the PrEP clinic line, and we're here for you. So, Nancy, thank you for this conversation and for the information you've shared with us. I do have one final question and something I wanted to touch on now that it feels like in this space of public health and prevention, we're finally talking a lot more about. Um, but as you may be aware, since PrEP was approved a while back, we saw most of the promotional material that was aimed and targeted at men. Are you aware of any campaigns for women or any advertising that target women? And likewise, why is it important for women to be part of this conversation and this prevention effort? And why should women consider being on PrEP? And I'm sorry, I actually realized these are like just not just one question, but several questions. And I know we could probably talk a lot about this and take all day, but it's something that I was just curious about.
Yeah, they're all great questions. And also, just for anyone tuning in, if you want to ask your own questions, you're more than welcome to put it in the chat. So, referring back to your questions, Kevin, historically, PrEP was targeted for men who have sex with men. And per CDC statistics and also HIV data surveillance from departments of health, this is one of the groups that is mostly affected by HIV. So while we are seeing that within that specific group, we are also seeing that Black and Latinx women are also being affected by HIV, particularly in the southern part of the US. And like you said before, Kevin, we are in a city that does have high HIV rates. And so in addition to that, STIs in general are rising for women as well. And so what we do know is that having an STI exposure or infection does increase your chances of acquiring HIV significantly. I'm also happy to share that here in the city, we do have a campaign that focuses on women called PrEP for Her. So this is a campaign initiated to empower women to be 100% in control of their own sexual health. Likewise, we have our Women Wednesday series, the Bag series, where we provide health literacy sessions, and that focuses on women's health, and PrEP is also part of our conversations. So women, they should consider PrEP for the reasons that I mentioned previously, but ultimately it is a personal choice, but it is a good one to take if you're looking to keep yourself safe and if PrEP is starting to sound like maybe this is a better option for you.
Wonderful. Thank you, Nancy, for sharing that. And yeah, definitely pray for her. It's awesome that we're finally starting to target more groups outside of just men, which is very important given everything that's happening. And now with pandemic and with COVID, we're so concerned about COVID, and rightfully so. But people are still having sex. Um, so of course, PrEP is something to consider. Um, so thank you for giving us a quick overview and for the work that you're doing with PrEP navigation. So just to wrap up, if you are considering getting on PrEP, or maybe you're hesitant because you have insurance questions, or you don't have insurance, or you're underinsured, you can always call us at our PrEP clinic line 202-939-7690. You can also email us at prepclinic@whitman-walker.org, or prepnavigator@whitman-walker.org if you have any specific challenges getting your PrEP or getting your medication paid for. And we're here to talk to you. And yeah, thank you, Nancy, once again. Do you have any last words or anything? Thank you once again for the work that you've been doing. And yeah.
Sure. Just want to thank everyone that tuned in. If you do have any lingering questions, you can put it in the chat. Um, we've talked about various ways of getting more information on PrEP, either calling us or shooting us an email, but we are offering free HIV and STI testing by appointment. And during those appointments, you do have the opportunity to discuss PrEP with one of our staff members as well. So maybe you aren't necessarily comfortable giving us a call or asking a question right here in the chat. But if you wanted to get tested and you had some questions right then and there, we'd be more than happy to talk it through with you and provide you with some help and information.
Awesome. Thank you. Thank you, everyone. Bye
Hi.
now.
I just saw someone say hello, but bye. We're logging off now. But if you want to catch the beginning of it, we will be saving the live so you can watch it from the beginning in its entirety whenever you have time. Bye, everyone.
Thank you.